This video will show you how to properly administer your enteral bolus feed. Please follow all instructions shown in this video. Administering bolus enteral feeds can be safe and easy with proper instruction. When your enteral formula arrives, it should be checked to make sure the containers are intact and dry. If there is leaking of the formula during shipment, it may cause contamination of all formula containers in the shipment. Unopened enteral formula should be stored at room temperature range of 68 to 77 degrees Fahrenheit, as extreme temperatures may spoil the formula. Avoid direct heat, sunlight, and damp places when storing your unopened enteral formula. It is important not to freeze any liquid formula. Please begin by preparing your work surface by cleaning the area thoroughly with soap and water, or a disinfectant wipe, and drying thoroughly as well. Wash your hands thoroughly for at least 20 seconds, and dry as well. Use a separate towel to turn the faucet off. Feeding tubes vary and require different supplies. Some feeding tubes will have clamps, and some will not. Traditional feeding tubes can be used with a slip tip or cone-shaped syringe. While N-fit feeding tubes require supplies with special N-fit connections. Your nurse or dietitian may recommend using a valve attachment device at the end of your tube to open and close it. These too have traditional and N-fit options. The valve adapter for the traditional tube has a cone-shaped attachment that is inserted into the tube. The valve adapter for the N-fit tube has an N-fit attachment that is screwed into the tube like this. Gather the ordered amount of formula for your feed, a cup of tap or bottled water, and your 60 cc syringe. Be sure to follow the packaging instructions, as your formula may need to be shaken if it is in a can or bottle, or kneaded if it's in a bag container. You will need to flush your feeding tube with water to confirm that your tube is not clogged. Start by filling your syringe with water as directed by your healthcare provider. Attach the syringe to the tube or valve connector. If using a valve connector, open the valve and slowly inject the water into your tube. Next, close the valve and remove the syringe. Remove the plunger from the 60 milliliter syringe. Insert the tip of the syringe into your feeding tube or attachment device. Unclamp your feeding tube and open the attachment device valve. While holding your tube and syringe upright, slowly pour your formula into the syringe, being careful not to overfill the syringe. Continue filling the syringe with formula as it empties throughout your feed until the total volume is given. Your syringe should not empty during your feeding. If this happens, it can cause unwanted air in your stomach. This will not harm you, but it may cause discomfort. Once your feed is complete and the prescribed amount of formula has been given, clamp your tube or close the attachment valve. Then remove the syringe from your tube. Rinse the syringe with water and replace the plunger. Next, you will need to flush your tube. Fill your syringe with tap or bottled water as directed. Attach the syringe to your tube or valve attachment, unclamp or open valve, flush with water to clear the formula from your tube, clamp or close valve, and remove syringe. After your tube has been flushed, rinse your syringe and place it in the original packaging until its next use. Open containers of liquid formula should be stored in your refrigerator for 24 to 48 hours, depending on product label instructions. After 24 to 48 hours, open formula containers should be thrown away. Open containers of powdered enteral formula should be stored in an airtight container in a cool, dry place for up to 1 month. Once powdered formula is mixed, the liquid formula must be refrigerated and used within 24 hours. Unused powdered enteral formula should be disposed of after 1 month. Contact your dietitian for product storage instructions if you have any questions. Wash your hands thoroughly for at least 20 seconds, and dry as well. Use a separate towel to turn the faucet off. Proper enteral bolus feeding at home is important to your safety. Please call 1-800-755-4704, option 4, if you have any questions or concerns at all while administering your feeding. We are available 24 hours a day, 7 days a week. In the event of an emergency, always call 911.